Patients must have to know that when we do the embryo transfer, when we put the embryo inside of the uterus, only one thing can cause to go to put them out. Okay, those are uterus contractions, and otherwise coughing, peeing, walking, going to toilet, nothing can cause any falling or losing the embryos. Okay, because with some special force they will be sticked on the wall of the uterus, and only with the contractions of the uterus you can lose the embryos. Most of the time, a difficult embryo transfer can cause these contractions. Okay, if for example, unexperienced surgeon, a gynecologist can cause this, or sometimes, especially the patients had some surgery on the cervix, like for cervical cancer or something like this, the lip infection, lip surgery. In this case, the way from the outside to the inside can have some distortions. But now we have very good cervical catheters, and with them we never cause any pain, and we can pass even all way very easily. Okay, in this case, two things: experience with gynecologist and good chosen catheter. With good chosen catheter, you cannot cause any contraction. Otherwise, no. With the coughing, no.